Mark has asked that whether taking 3 aspirin would be better than taking 2 aspirin. Would it help more or would it hurt more? This is a bit complicated because, and the same thing applies for most over-the-counter medications. If a little bit is good, is more going to be better or is it going to be toxic? And so it's hard to answer this aspirin question specifically because we don't know what dose of the medicine that he's particularly talking about, taking the extra dose. But aspirin and all the aspirin-like products, which are called nonsteroidal anti-inflammatory drugs, ibuprofen, naproxen, all these, which would be marketed like Advil, Motrin, and Aleve, these drugs are available over the counter, and in general, when the FDA approves a drug to go over the counter, the dose that they use is lower than the dose that would normally be used when a doctor writes a prescription. So there definitely is some room, generally speaking, to increase the amount beyond what it says at the label. But in particular, for the aspirin and the nonsteroidals, we have to be concerned about upset stomach and in particular the potential for bleeding. And these drugs all have the potential to do that, and the more that you take, the more that the potential is. So in general, you should always try to take the lowest amount that works. But in most cases for over-the-counter products, if you take a little bit more, it's not going to hurt, and it may be a little bit more effective.